Welcome back to Marketing with Soul on the Relevant Podcast channel, where we discuss how to make healthcare relevant to modern consumers. I'm Jared Johnson, founder of the Shift Forward Health Production and Marketing Group.
And I am Peter Balistrieri, Director of Communications with WVU Medicine and the Rockefeller Neuroscience Institute.
Our goal here is to open your eyes to the many ways in which organizations are marketing to and engaging with modern consumers about their health. We'll guide you through 3 segments, each based on parts of a soul song: the hook, the groove, and the call. These episodes are fast-moving, so let's get right into it here. Peter, we're going to start with the hook. The hook today is talking about primary care at the intersection of care and technology. So we're going to focus on 2 organizations here, Best Buy Health and Forward Clinic. And the commonality here is how they attempt to integrate technology at maybe a faster pace than what we're used to. And this isn't necessarily clinical technology. Some of it is, but it's also more consumer facing. So that's kind of the common thread here. So what we're talking about in a lot of ways in our previous episodes, we've looked at how a lot of what we consider disruptive organizations are, how they're positioning themselves, especially to consumers, because we're trying to understand what are they saying differently and what can we learn from that. So I'm going to start with Best Buy, and what we usually do is just kind of jot down some of the things that we observe initially from looking at their websites. Again, that's usually a place where you can see a positioning statement, you can see some basic marketing messaging and what an organization is attempting to do with their marketing. So I'll share a little bit about that, and then we'll get into the groove here. But in fact, even before I do that, Peter, initial reactions or just thoughts about Best Buy Health and Forward Clinic and how they involve technology.
You know, what really got me interested in this one was the fact that they're kind of their hook, if you will. Their one of their marketing messages is around the delivery of hospital level care in the home. So they're not talking maybe some of the kind of the primary care or secondary care. I mean, it sounds like they want to go a little bit deeper on some of these things. So they're talking cardiac, COPD, pneumonia, asthma, infections, and they even do go to the level of saying other medical and post-operative conditions. So this one's really interesting in that I was trying to get a sense of kind of what the audience age or the demographic might be, because where that might skew a little bit older for some of those things, yet then they're talking about how they're going to have specially trained Geek Squad agents, helping with the healthcare aspect of this. So that's kind of our world, the kind of Gen Xers, because I kind of grew up with, when I wanted to get my gaming computer fixed, I'd call the Geek Squad. And then, then they're talking about wearables, sophisticated wearable devices and putting something on somebody to get a quick readout, almost like how we do with cars now, so it's real sci-fi oriented. And you're almost buying into, pun slightly intended, the Best Buy approach to technology. Everyone knows that Best Buy is a tech store, right, in a way. So interesting kind of approach to their marketing from that standpoint so far.
I agree. All right, let's dive into the groove here. This is where we get into more details. And one of the details that sticks out to me I'll just go quickly with Best Buy because there are some common threads here. But again, messaging, positioning statements, they're on their website. If you go to Best Buy Health, it's healthcare.bestbuy.com is where it takes you to. The headline is Best Buy Health meets you at the intersection of health and technology. And I always try to analyze this from a consumer-driven standpoint. If I'm looking for what's different, if somebody said, hey, check this out. The thing is, this is probably the red herring out of all the organizations we've talked about so far, because people don't go to a Best Buy Health clinic. This is different than primary care that we've been talking about from anywhere else. This is a provider of very specialized types of tech-enabled healthcare that are primarily coming out of the home and other use cases, if you will, other types of care that maybe we don't focus on in a traditional healthcare organization. Where they focus on their website, at least, is in active aging and well-being, bridging gaps in independent living, and connecting health systems to the home. And then they describe it from there. So it is a little different, but I think the fact of what I've wanted to look at here is how they do bring tech in and explain why they care about that. Because if you do scroll down later on the page, it does look like basically the rest of Best Buy's website, because it talks about their customer care, the urgent response of their customer care teams. The wording is a little different. It's at a different reading level, if you will, than a lot of the others that we've described. I mean, last episode we talked about ChenMed, and it was extremely simple. These guys use words like acuity-based solutions, which I still have to think for a second what that means. And I've been in the industry for a while in terms of like, what are they talking about there? So this isn't, hey, go schedule a clinic, go schedule an appointment, come to the clinic, check out our doctors. Yeah, they don't. Best Buy Health doesn't employ doctors, but they provide solutions to help a care team. So this is one I'm paying attention to more just to see if we'll hear more about things like this and see more technology being focused on in a healthcare brand's position. So I think it's kind of like okay, interesting. It's very different. And we did pick them on purpose to talk about them because it's different. And we'll explain what the difference is between them and someone like Forward, like a Forward clinic. But I just thought it was interesting to see that somebody really is focusing on the intersection of health and technology is the way they would say it.
Yeah, and I like that they did say in one point that it's the coming together of technology and empathy. It's a little bit of a marketing kind of mantra, if you will, or tagline. But it's interesting that they say they're gonna leverage the power of social workers and paramedics and nurses and physicians, but also the technology to take care of patients in their homes. But then you kind of rub that up against, and there's some friction there because they're saying that they're going to be, more of the advanced level care. So advanced care, typically that's inside in a hospital. So I'm kind of not understanding, kind of their approach, because sometimes it kind of flies in the face of what they're trying to do. So maybe it's me, but I'm a little bit confused as to where they're going. So I'm going to kind of watch them a little bit too as we go forward. And finally, I'm not sure that the Geek Squad and the approach of Best Buy here feels. I don't know. I don't know that I feel very taken care of or safe. And it's kind of that Walmart one that we talked about too. Like there's a stigma, I think. So they've got some things. They've got some of their own hurdles, their own brand hurdles, I think, to overcome as they go forward with this this particular aspect of their business. So just we'll see what happens with it.
Yeah, I like that. I think it's fair because that's not where they've come from, and so you're right.
Right.
And it's kind of like ChenMed in our last episode, we described that it's almost a shame because from what I know about their actual care teams, they deliver some incredible care in incredible ways that really does stand out. And that message wasn't necessarily jumping off the page, if you will, from their website. And it's kind of the same here with Best Buy. What they're doing with their partnerships with Atrium and others on the hospital at home side is actually pretty groundbreaking. And yet that does not come through at all with their marketing here. So interesting there and maybe something to learn. Mm-hmm. But let me scoot over to Forward Clinic here for a moment, and we'll see if we can draw some ties here. With Forward, their website's it's always been an interesting one. Ever since I came across I think it was a Facebook ad that I first came across of theirs, and it was a model opening the clinic door and saying, "Come on in," and the camera kind of follows them around and let me show you real quick how this works. And the clinic itself is breathtakingly beautiful. I will say that it's like the most modern looking clinic in short-term memory, at least, that I've just always been taken aback. I'm like, okay, that has my attention, but what does it mean? And what is the experience like? And on their website, the headline is finally a doctor dedicated to your long-term health. That's just been always one of the headlines that I remember thinking, okay, that's bold. But right below that, they say, hey, welcome to healthcare the way it should be. A doctor focused on preventing heart attacks and cancer and not just treating your rash. And it goes on below there from that. Right, exactly. It's kind of like, okay, that's cute, right? Are they really going to be able to deliver that? Again, we're focusing on what's the brand promise? How is that different? Is there something we can learn or try ourselves? Because this is what's out there in some markets. Forward Clinic is absolutely not in all locations, but they have expanded over the years. And this is depending on how their funding goes, from year to year, they can continue. They have plans at least to expand into additional markets. So they do just focus on, I do love the messaging. I love the fact of we're focused on preventing heart attacks and cancer. I think that's the first one so far that has used the word prevention at all in one of those lead marketing messages. So
that's what I noticed too, Jared. This one was interesting to me because I looked at this one right after I started looking at the Best Buy one, and it was so much more clear, if you will, and pointed in terms of their marketing messaging about prevention and being proactive, and to the point where they're talking kind of you're going to get that initial visit, and you're going to get biomarkers, and they're going to customize a journey of healthcare for you based on what those biomarkers are showing, and through panels or whatever it happens to be. But technology is going to allow them to stay ahead of your potential healthcare risks. And I thought that was pretty interesting. I was pretty taken back by that, because they're very, very clear on that, and they're talking about some very specific high risk genetic and hereditary things: diabetes, hypertension, cancer. Then they go into more even kind of the everyday things, like not to take anything away from them, but things that can be managed: stress management, high cholesterol, weight, nutrition, diet, things along those lines. All of those could slot under preventative healthcare, right? Because if you're doing all those things right, you're essentially taking away less of the healthcare risks that happen as you get older. So I just thought that was pretty interesting, and the fact that they've kind of built themselves up as a kind of a collaborative physician attention to care. So they've got doctors that are creating individual plans in lockstep with the members, so that the goal is to just maintain proactive health. And I thought that was pretty interesting. I kind of want to watch this one a little bit more as we go forward.
Pun intended.
Did you like that?
Like that. Like what you did there. Yeah. My final comment on these guys would just have to do with, at least in this segment, would be, as I go to under how it works on their website, then you go to our technology. And the headline there is "Quality Care Starts with Advanced Technology." I had to ponder that for a little bit, just from a messaging standpoint, and say, does it though? Yes, but it's because that this is the brand promise. Again, like you said, they are very clearly drafting a higher level tech-based, digital-based experience here, and they are positioning it very differently. So the amount of personalized data that can help you, that can lead to a discussion about preventive care, that can lead to a discussion about very specific, like I said, biomarkers, just other parts that aren't typically part of a primary care based conversation. There's just simply usually not enough time for that. So I do think that in their case, it fits the bill. It's what their differentiator is. It's the type of experience they're trying to create. And sometimes, as we've seen with some of the other disruptors out there that we've been talking about in primary care, ChenMed was for Medicare Advantage members. So not every one of these new plans or services or care models is for everybody. And some of them are trying to be, like you just pointed out, Walmart and CVS and Walgreens have plans in that direction, trying to be there for the masses. But some of them are just as disruptive potentially by being very focused on their niche in terms of what kind of patient they're trying to appeal to. So yeah, I thought that was interesting in terms of them saying quality care starts with advanced technology. And yeah, with that, we can roll right into the call. So the call is going to be an interesting one, I think, here. This is where we look at what's one thing that marketers can do with this information to market with soul. In other words, how can we actually improve the health of our society here in America? And again, I love asking this question, Peter, because you always have some great insights here. And quite frankly, I'm not hearing other people ask this question because there are limits to where marketing can take us. But I think it's interesting the fact that it kind of opened both of our eyes, even just going through Forward Clinic's website as well as Best Buy Health's, of what they're using technology to enable. And they are clinical technologies, but they're in the hands of a consumer. So it's a cross section of the types of technology they're talking about. Can advanced technologies that they are providing lead to a different conversation that does talk about preventive care? If that's the case, which I mean, that's what they're doing right now, so how successful is it? That kind of thing, I don't have any insight into, but does that provide a higher level of experience or even a perception that it is a higher level? I can see that absolutely being the case. And if anything breaks down a barrier to lead people to seek care more often, especially when it's very much needed, either because of genetic predisposition or whatnot, or because somebody's open to trying to prevent something, that's helping the health of our society, in my mind.
Agreed. I mean, and they did a campaign a little while back. They called it "Healthcare is Backwards," and it was designed to kind of expose the current healthcare system. And at that time it was making it harder for people to care about their healthcare. And have to use archaic tools and rushed visits and hidden charges and all that kind of stuff. So, again, we talk about the marketing of these disruptors, and that's clearly getting to the root of the pain points of many of the demographics that is using healthcare across the United States right now. So, interesting thing there. One thing I'm seeing a little bit working on the healthcare side that I'm going to see if it translates over, because I feel like hospitals are starting to get this down. Is that, and I'm wondering if this is already happening in the disruptor market, if you will. Is the hospitals are doing a really good job of understanding what are the upsells of certain disease states, and I'm not wanting that to sound flippant, but in certain things like, for instance, in pediatric care, spina bifida has multiple multidisciplinary areas that need to be seen: urology, orthopedics, neurology, all of those areas. And, it's to the point where people can't make that many trips to the hospitals. And of course, we're going to talk about telemedicine in upcoming episodes and such, but hospitals are getting better at understanding the plight of their patients, and they're starting to consolidate these services into quote unquote clinics. So a spina bifida clinic will include a one-stop visit with the neurologist. Then half hour later you're with the urologist, and a half hour later then you're with the orthopedist. And it really is incumbent upon the hospital's scheduling teams and, how many people they employ and all those things to coordinate those visits amongst themselves, the caregivers, with their patients. So I'd be interested to see how that's going to kind of cross over into these disruptor areas too, because especially for maybe the older population, the one that we talked about in a previous episode, ChenMed. So, if they're dealing with certain things that have multiple areas, say cancer, or diabetes or whatever, how do they deal with that? And are they going to set themselves up for one-stop shops, kind of, if you will? So just wanted to throw that in there today, because it's interesting that hospitals are approaching that as well.
Great place to wrap up today. And with that, that's actually enough talk from us. Now it's time to go do something about it. On behalf of Peter, this is Jared reminding you that modern consumers expect to engage with their health in modern ways. So be sure that you're marketing with soul. Thanks for listening.